So in this model, looking at arterial vessels, we'll start with the aorta, which is of course right here, and it curves. At the top of the aorta, you have the brachiocephalic trunk. You have the left common carotid artery, and then this left subclavian artery. On the right side, we can't see the right common carotid artery. It would parallel this one on the right side. And we cannot see the right subclavian artery either. It would be like this one, but on this side. Moving away from the aorta, you have the descending thoracic aorta. Below the diaphragm, you have the descending abdominal aorta. The first branch off of the aorta, below the diaphragm, consists of these three major arteries, but the entire structure is called the celiac trunk. And then these three branches of the celiac trunk are the hepatic artery, gastric artery, and splenic artery. Immediately inferior is the superior mesenteric artery. Then you have the right renal artery and the left renal artery. Continuing down, it's not on this model, but it should be there, the inferior mesenteric artery. And then you have the right common iliac artery and the left common iliac artery. Going back to the top, with veins, you have, of course, the superior vena cava. This short piece here is called the right brachiocephalic vein. You have the right subclavian vein. And then here is the right internal jugular vein that would go all the way up alongside the carotid artery. On the left side, you have the left subclavian vein, the left internal jugular vein, and the left subclavian vein. Below the diaphragm, this entire major vein is the inferior vena cava. Then you have the right renal vein, the left renal vein, and then you have the right common iliac vein and the left common iliac vein.